This is a video of 20 ovarian cancers described using IOTA terminology. My name is Suzanne Johnson and I'm a gynaecologist from Southampton. On this channel, in the IOTA playlist, there's a video on how to diagnose adnexal masses, and you may want to watch this one first. There's also a video on published literature, including this, the original IOTA paper, which is essential reading. I will show you 20 cases of ovarian cancer. Sometimes it's immediately obvious what you're looking at, and IOTA call this a simple descriptor. When you see a tumour with ascites and at least moderate colour Doppler blood flow in a postmenopausal woman, you can say with a high degree of certainty it's an ovarian cancer. These are the other simple descriptors. There are 4 benign descriptors and 2 malignant descriptors. If it's not immediately obvious, then there are simple rules to help you. There are malignant features in simple rules, which are irregular solid mass, at least 4 papillations, irregular multilocular solid greater than 100 mm, ascites, strong vascularity in one area or throughout the mass. And this is a schematic showing benign and malignant features to use in simple rules. The rules are that if there are 1 or more malignant features in the absence of benign features, the mass is classified as malignant. Using simple rules, we can then classify a mass as being malignant. Be careful with benign features. If you have 1 or more malignant feature, but you also have shadowing, which is a benign feature, that doesn't make the mass benign, it just makes it uncertain. Where there are both malignant and benign features or neither, the result is inconclusive. So in this case, you cannot say whether the mass is benign or malignant, it is uncertain. Here are some examples and I will describe them for you. This mass is irregular, solid, with strong vascularity. It's irregular because some of the internal cystic spaces have an irregular shape, and it's solid because more than 80% of this mass is solid. There are some cystic components, but overall this is a solid mass. So it's irregular solid with strong vascularity. You can see using colour Doppler blood flow, there's strong vascularity in this area of the mass. This lesion is multilocular solid. It is multilocular, it has more than 1 locule, and it has solid material. So it's multilocular solid. And here the vascularity is moderate. This would give a colour score of 3. So it's multilocular solid with moderate vascularity. This lesion is solid, and it is irregular because the outline of this mass is irregular. And it is strong vascularity, a colour score of 4. Irregular solid with strong vascularity. This mass is multilocular and solid, so it's multilocular solid. There is some minor vascularity at the edges and there is some shadowing. So this mass is multilocular solid with papillations, minor vascularity and shadowing. This is an unusual mass. Again, it is irregular solid. The outline is irregular. The internal contour is also irregular. So it's irregular solid, no vascularity, and some shadowing. So this mass is irregular solid, no vascularity, some shadowing. This mass is irregular solid with strong vascularity. Again, this one is irregular because the external contour is irregular, but also the internal cystic spaces are irregular, with strong vascularity in one part of the lesion. Irregular solid with strong vascularity. This lesion is irregular, multilocular solid with shadowing. So you can see there is more than 1 locule, so it's multilocular. There's also solid material, so it's multilocular solid with some shadowing. This mass is irregular solid. Again, the external contour of the mass is irregular. And there is some minor vascularity. Irregular solid with minor vascularity. This mass is multilocular solid. It's irregular. Lots of papillations, moderate vascularity and shadowing. So this is irregular multilocular solid with papillations, moderate vascularity and shadowing. This is a video of a mass which is irregular solid. You can see all the internal cystic spaces have an irregular shape. This is irregular solid. This lesion is irregular multilocular solid with strong vascularity and shadowing. Note the shadowing just here. Irregular multilocular solid with strong vascularity and shadowing. And this is a video of an irregular solid lesion with papillations and ascites. There's the mass and there's the uterus coming into view. Irregular solid with papillations and ascites. This mass is irregular solid with a small cystic component, but it's less than 20%, so this is still considered a solid lesion with strong vascularity. Irregular solid with strong vascularity. This lesion is irregular solid with strong vascularity, and there's a suggestion of ascites, but you would need to know that this fluid extends beyond the uterine fundus, as I'll show you in a minute. Irregular solid, strong vascularity, and possibly ascites. In this case, both ovaries were abnormal, and they are both irregular solid with strong vascularity in the right mass and moderate vascularity in the left mass. Bilateral, irregular solid, strong vascularity in the right mass and moderate in the left. This is a video of an irregular multilocular solid lesion with papillations. You can see the papillations jutting into the internal cystic space. Irregular multilocular solid with papillations. This video shows an irregular multilocular solid mass with papillations, shadowing and probably ascites, but again you'd need to refer to the level of the free fluid. You can see that the internal wall is very irregular, even where there aren't papillations, it's very irregular. Irregular multilocular solid with papillations, shadowing and probably ascites. This is a video of an irregular multilocular solid lesion with papillations and ascites. You can see the swirling free fluid all around this mass. It's irregular multilocular solid with papillations and ascites. When you want to know if the ovarian cancer is advanced, you look for spread, and that would be ascites, serosal deposits and omental nodules or omental cake. The definition of ascites is free fluid above the level of the uterine fundus, and in this example, this is the anterior wall, this is the uterine fundus, posterior wall. All this fluid is in the pouch of Douglas, but this fluid extends to beyond the level of the uterine fundus. So in this case, this is ascites. Here you can see an irregular plaque of tumour in the pouch of Douglas, and when you turn on the colour you can see it's strongly vascular. So this is peritoneal involvement of the serosa in the pouch of Douglas. The fluid here you can see is quite cloudy, and that's ascites. This is a video of a thick irregular serosal plaque in the pouch of Douglas. You can see it just here. Here it comes. So if you put your probe in the posterior fornix, you'll be able to see the serosa if there's free fluid, and you'll be able to look for such serosal abnormalities. Thick irregular serosal plaque in the pouch of Douglas. This is another example of a serosal deposit, nicely outlined by the fluid there, which when you put colour on is strongly vascular. This is a serosal tumour deposit. And then on transabdominal ultrasound, you can look for omental cake. Here you can see ascites, and in the longitudinal plane, here you can see this grossly thickened omentum. Here is a video of that. You can see thickened omentum floating in the ascites. This is on transabdominal ultrasound in the longitudinal plane in the epigastrium. Omental cake. So in conclusion, when you are looking for ovarian cancer, you may get it on a simple descriptor as a tumour with ascites and at least moderate colour Doppler blood flow in a postmenopausal woman. Or you may see malignant features from simple rules: irregular solid mass, at least 4 papillations, irregular multilocular solid mass of more than 100 millimeters, ascites, or strong vascularity in one area or throughout. This is the report pro forma that I use to categorise what I'm looking at and to decide whether it's benign or malignant. You may want to pause the video and copy this. Thank you.